you all good health because nowadays so many diseases are emerging or re-emerging. Before going to the actual vector-borne diseases as such, which is my topic of interest, let me introduce certain communicable diseases which are also giving us a lot of trouble, especially recently, which may not be vector-borne. So as such, I will give you a few examples of non-vector diseases which actually haunted us in 2024. So communicable diseases as such is a major health issue, I need not tell you. It, involves the infectious pathogens passing from people to animals or vice versa. So it may be non-vector borne also. For example, the latest being HMPV, that is human metapneumovirus, and yesterday's news shows that 7 cases have been detected in India, and especially among infants. 2 from Bangalore and 1 from Ahmedabad and 2 from Tamil Nadu, etc., etc. So it is just like actually COVID-19 illness, respiratory illness with flu-like symptoms. And today's morning news shows that the government of India Health Department has advised people not to panic. It was originated in China. Incidentally, same, first week of January 2020, when I was delivering a talk like this, I happened to mention about the danger of COVID-19, because that time COVID-19 was just started in Wuhan, China. So probably it is only incidental that I have to introduce this new virus in 2024-25 to you. Hope that nothing serious will happen, because as such there is nothing to panic. That is fine. Another new introduction I would like to make is Dinga disease, which has also given some scare in 2024, though not in India. It is a mystery virus. Overlapping symptoms with other diseases like dengue, malaria, chikungunya, etc., fever, excessive body shaking. But here an exception is excessive body shaking. That hampers the mobility. It is not new actually, but history indicates that in 16th century, beginning of 16th century, that is 1518, it was prevalent in France. So, and they call it a dancing fever, because the body shaking would continue to an exhaustive level, and people even died. And history shows that this year, that is last year, about 400 cases have surfaced again, and people are suffering from this disease, but it's called Dinga disease, a viral disease. Hope that it will not reach India. Okay, now Nipah virus, 2024, it has given enough scare to the southern state, especially Kerala, 6 cases and 2 deaths, and successfully they could control it. Especially Kozhikode and Malappuram districts, because it is highly communicable or contagious. People who were treating the patients have taken extreme care, and also they have taken all the leads or in order to trace the contacts, and finally they could control it before getting out of hand. So this, of course, the history I need not tell about this. And another one, this origin was in Nipah village, that is Sungai Nipah. That is the reason why the name Nipah virus, a village in the Malaysian peninsula. And in India, it has been shown that the reservoir organism is bats. But elsewhere, in Nipah, it was found that it was spread from the pig, because in the pig farms, the farmers used to suffer and die. So later it was found that the reservoir animals were pigs. But in India, no such discoveries have been made, and it is suspected that it is, being proliferating in bats. Okay, that is another non-vector disease. Then another 2 more introduction I would like to mention is, though you are familiar with bird flu, variant of bird flu is H3N2, influenza A virus, that is also called Hong Kong flu. 2023-24, it was found to circulate in pigs, just like swine flu only, but it is a different variant. One person died in Karnataka also. So that is the reason why we have to be a bit careful about these new viruses which are found elsewhere, but due to the travel, etc., it may reach our nation also. Prolonged cough, sore throat, runny nose, breathlessness, etc. All these are viral. Being viral infections, naturally the symptoms would overlap. So it is found to be more severe than the swine flu. So that is the reason why we have to be careful. Often undergoes genetic changes. So that again being obvious, these microorganisms often undergoes mutational changes often compared to higher organisms. And another scare was from avian influenza, that is H5N1. That too persisted in 2024, especially in USA. It has created more fear. And one person died on 7th January. That is the latest. That is yesterday. Yesterday's news shows that there were no deaths, but one person died yesterday. So India also, it is giving a lot of scare because the virus has been detected among zoo animals in Nagpur. So naturally, caution has been raised against the spread of avian influenza, which repeatedly have given scare in different parts of the country, especially among ducks and migratory birds, etc. Now, monkeypox virus that is also giving a lot of scare. Since 2022, 30 cases have been detected in our country, similar to smallpox but less severe. So one need not panic. Typical viral symptoms: rash on the face, spread to the hands and face also. Spreads like COVID-19, that is through contacts. That means if we take proper care, avoiding contacts with the patient or a person suffering from this particular viral disease, it could be easily controlled, or the spreading can be prevented. And symptoms, of course, persist for 2 to 4 weeks. As we can see on the slide, blisters are very common. That is the reason why it created a lot of fear among the persons. Now, I come to the emerging vector-borne diseases, which are, of course, my topic as such. Now, I wish to introduce a new viral disease, Oropoche virus. That is, 2024. This was reported from America. Oropoche virus is a vector-borne virus. South America and the middle of Americas, that is Caribbean areas. And up to 13,000 cases and 2 deaths, have been reported. We have no, information with regard to the emergence of this virus in our country. It gives a lot of, trouble because of the central nervous system impact. That is, it is neuroinvasive. It enters the central nervous system, and an encephalitis would be, and meningitis would be created or will result, and the person might die after entering into coma. It spreads through midges, dipteran insect, culicoids. These are culicoid insects, midges found in the, and this virus was also found in the semen and human. But there are no reports with regard to the sexual transmission of this particular virus. But finding shows that its presence in semen and human milk as well. Mainly in US, it was found among travelers. So naturally, some of these diseases would spread through travelers. Unless there are quarantine measures, it might reach other countries as well. This particular virus emerged in India, especially Gujarat, Maharashtra, and Rajasthan. And history indicates that Chandipura village, its origin was in Chandipura village, Maharashtra, in 1965. So the name Chandipura virus. And especially among children, it creates acute encephalitis and often fatal. For example, the data shows 82 deaths in 2024, And according to WHO, this may be the largest outbreak in 20 years because there were 245 cases, and out of which 82 people died. So high death rate so far as this particular neuroinvasive virus is concerned. And vectors are sandflies. These sandflies are, common flies, which is a small one, 1 to 5 millimeters in size. And they have got, as you can see, the wings are spread outward and upward. And in addition to that, even ticks and Aedes mosquitoes may also play a role in the transmission side. And being very, invasive, especially neuroinvasive, it creates encephalitis and resulting in coma and death. And the repeat outbreaks, the history shows that there may be repeat outbreaks with a gap of 4 to 5 years. So naturally, this is a very important viral disease against which we may have to be take careful. I mean, these are the foci. These are the foci where Chandipura virus may be hiding because antibodies have been recovered from these areas. Though it's 2024 outbreaks were in Gujarat, Maharashtra, etc. And the virus, the bottom one is the shape of the virus, just like a cigarette shape. You can see here. And it is called pediatric viral encephalitis because mainly among children, we will be able to see the spreading of this virus. Rapid progression to seizures, altered mental status, coma, and encephalitis. Brain inflammation will be resulting. So, because of the ability of this virus to cross the, blood-brain barrier, so resulting in the disruption of blood-brain barrier, naturally it will affect the central nervous system, resulting in meningitis and encephalitis. So the invasiveness of this particular virus, it will enter and destroy the cellular components or utilize the host machinery also for the primary transcription, synthesizing its own mRNA, and then secondary transcription for synthesizing the more mRNAs, and then translation synthesizing the glycoproteins, then a matrix protein, and endoplasmic reticulum and Golgi apparatus also involved in the maturation of these proteins, and also nuclear proteins and phosphoproteins and long proteins. All these proteins are involved in the assembly of the virus, and then it will be budding out or proliferating out, destroying the cell. So this is how a large number of viruses are proliferating or produced, and then through blood circulation it will be transported across, and it will reach the central nervous system also. That is why it is called hematogenous route of central nervous system invasion. That is through blood vessels or through blood circulation it will reach central nervous system. And the primary route for majority of neurotropic viruses are like this only, whether it is Japanese encephalitis or other type of virus infections where central nervous system is affected. The route is usually neurotrophic entry. So generally, infect monocytes, macrophages, dendritic, and Langerhans cells. See, majority, all these are involved in the primary defense mechanism. Monocytes, we say that is white blood cells, which will be converted into macrophages or dendritic cells. Dendritic cells are the antigen presenting cells, and macrophages, the primary defense cells mechanism. All these are affected. All these cells are affected. Naturally, our it will hoodwink or weaken the immune system to start with, and then get transported across through the blood circulation. So that is how even other viruses also will have the same type of infective routes. transported to epithelial and endothelial cells. So endothelial, that is the layer lining the blood vessels, and those cells are affected, and finally it will bore it, or it will destroy the endothelium and come out. And fibroblast also and muscle cells also would be affected. So blood-brain barrier disruption with increased permeability. That is the reason why on the skin there will be lesions. Because of the blood oozing under the skin due to the breaking of the microcapillaries. So this kind of a disruption with increased permeability is a pathological condition. So that is one of the symptoms that we may be able to see also. For example, in case of dengue and other type of infections also, we will be able to see this kind of neurotrophic viral infections will create such problems.
As far as the life cycle and ecology of the vectors are concerned, these are phlebotomine and sandflies. They are called sandflies mainly because they prefer to rest.
Okay, these are phlebotomine sandflies which got wings are held upward and outward, long palpi, 16 segmented antennae are there, piercing mouth parts, etc. Though there are 700 species, only 70 are vectors. 70 are vectors. These are vectors of leishmaniasis also. Leishmaniasis is also very strong vector like mosquitoes, and it is capable of surviving in very dirty areas or ruined buildings, cracks in house walls, animal shelters, and in household rubbish. So if hygiene is maintained surrounding the house, etc., to a large extent, the breeding of this particular vector can be prevented. Just like mosquitoes, it also has got 4 instars. And only females are vectors, not males, just like in line with mosquitoes. So prevention is best, that is vector control, protecting against the bites of sandflies, mosquitoes, and ticks. Same way how exactly we control or prevent the mosquito bite, that way, and ticks, we have to take care of our pets, pet animals, and our surroundings, etc., should be kept clean. And usually when the housing is poor, that is unplanned housing, and when sanitary conditions are bad and waste management is not proper and sewages are open, etc., this would actually enhance the sandfly breeding. And also increase the vector access to humans. So, and at this moment, no vaccine or medicine available for Chandipura virus. So that is a bad news. Symptomatic treatment will be given, and prevention is the best thing. Hope that it would not spread further, and it is under control now. Further outbreak should be monitored, and surveillance is one of the important public health programs one has to, or a country has to undertake. Then only we will be able to contain or control any disease or emergence or re-emergence of any disease, because vectors are always there with their vectorial capacity. They are potential arthropods. They are surrounding us. Many of them are biological vectors. They have got the genetic ability which is inherent to maintain the pathogen and facilitate the completion of their proliferation of life cycle. And there are mechanical vectors also, which would carry many of these pathogens through their body parts, such as legs or the antennae, etc., through physical contact. And they are abundant everywhere, and their host preference, hematophagous. These hematophagous insects are the dangerous ones. They are zoophilic or hematophagous or abiphilic, etc., etc. And their dispersal is also very important in how far they will be able to fly or move around. And of course, all these insects or groups, for example, mosquitoes or ticks, are not vectors. The majority of them have got the capacity to defend themselves against the invasion of these pathogens. Such insects or vectors or such arthropods are called refractory, and this phenomenon is called refractoriness. That is a kind of a defense system in insects also. So there, the transmission as such, for example, malaria or dengue or this Chandipura virus disease transmission, etc., called horizontal transmission. That is from a source, from animal source or a person, suffering from the disease. A vector will bite and then it will transfer to another healthy person. This is a person. This is called horizontal transmission. So in addition to that, we have got another type of transmission. It is called vertical transmission. Vertical transmission is more dangerous than horizontal transmission, because horizontal transmission is easy to control. Because if you control the vector, or if you give protection for the suffering person, to a maximum extent, control can be achieved. Whereas vertical transmission, the virus or the other pathogens will be maintained in nature even without having any virus load or pathogenic load, because the virus will be there with their larvae or nymph, because the virus or the pathogen would be passed through the eggs. So the eggs laid would be infected, then the larvae would be infected, nymph may be infected. So this kind of transfer of the pathogens through the life cycle, that is through the eggs, it is called transovarial transmission. And then if the larvae would transfer the infection to the nymph and then to the adult, it is called transstadial transmission. That is from one stage to another stage, larval stage to nymph stage to adult stage. It is called transstadial transmission. So this is more dangerous than the horizontal transmission. And blood feeding capacity also, that is also very important. Two types of feeding categories: solenophagy and telmophagy. Solenophagy or it is called capillary feeding. That is directly blood will be taken from the capillaries of the vertebrate host. That, for example, mosquitoes or sandflies, etc. Telmophagy or pool feeding, for example, ticks, fleas, etc., breaks the skin and capillaries bleed, and a pool of blood is created below the skin, forming a tiny blood pool on the skin surface. So from that pool, it will be taking the blood during the act of biting or blood feeding. So telmophagy it is called. So this, the right one is the solenophagy and the left one is the telmophagy, blood pool, and then the blood will be fed. This blood sucking solenophagy, if time permits, I will show you a video later. Then the most important component in a vector is the saliva, so far as the success of the feeding and transmission of the pathogen is concerned. Transmission may not be a purposeful act, but feeding is, of course, a purposeful act. But then, if the vector is infected, naturally, inadvertently, it will be transferring the pathogen. That is why it is called saliva, the complex cocktail. It is a cocktail of various proteins. It is a congregation of various, just like the pharmacological, components or medicines like that. In addition to pathogen transmission, it can interfere the host hemostasis and inflammatory pathways by transferring various proteins through the saliva, which is preliminary to the blood feeding. It has got anti-hemostatic component that is called lipocalins, and apirase protein inhibits platelet aggregation, so that when a small or the most minor wound is created during the act of blood feeding, it will naturally it will undergo clotting, unless there are components which would prevent a blood clot. Just like we take medicines for preventing blood clot, thinning blood, etc., etc. There are proteins included in the saliva in order to prevent, clotting. Anticoagulants, immunosuppressant. You do not feel any pain and inflammation until the feeding is completed. Such immunosuppressant proteins are there. keep swelling and hypersensitivity reaction down. And vasodilators, the microcapillaries are being very small. It would be dilated a little to have free flow of blood until the feeding is completed. Vasodilators, people take medicine for vasodilation also. That is the reason why now a new field of research has emerged, universal vaccine against saliva proteins. So that if a vaccine is there to act against the saliva, we may be able to prevent the pathogen transmission. So that may be the idea. And the promising results have been obtained in animal models. So that way we can target the salivary proteins because majority of these proteins have been identified. Major proteins of our interest, have been identified. A person by name Ribeiro has worked for over 20 years just on the saliva in order to find out various components of the saliva and their activity, etc. So over a long period of 20 years, he has worked. So these some of the proteins in the saliva are cytokinin, alter the immune response. Then next one, inhibit immune receptor CD47, which controls several immune processes. Then AVA1 promote viral transmission by activating autophagy. So the cell, damage would be activated so that viral transmission would be permitted. So in addition to the earlier vector-borne diseases, some of the diseases of local importance I have enlisted, especially in these recent decades, several vector-borne diseases which are being ignored or undiagnosed, or we may not have proper tools to identify it, and simply identified as viral fevers, etc., are on the list. For example, rickettsiosis, spotted fever, murine typhus, scrub typhus, etc. It may not be very familiar to you. It is there in many of our states, but may not be properly diagnosed. Crimean Congo, hemorrhagic fever, Lyme disease, etc. Other than Zika virus and Kayashinur forest virus, you are already familiar with. So we should give the credit for the discovery of this bacterial group of diseases called rickettsiosis. Howard T. Ricketts, an American pathologist, discovered the class of diseases carrying the microorganism known as rickettsia. So after his name, to give due credit to Ricketts, this particular species, notorious species, spreading the disease is called rickettsia rickettsii. So such a few of these diseases I wish to introduce to you and their details also. Excuse me. This group of diseases, disease rickettsiosis, includes spotted fever, endemic typhus or murine typhus, scrub typhus, etc. These altogether are caused by small gram-negative obligate intracellular bacteria and mainly transmitted by ticks, mites, fleas to humans, and reported from various parts of India as well. But their occurrence may be rare on record, but it is there widespread everywhere, as we do not have proper diagnostic tools. We could find their presence only in a few states now. This bacteria is about 0.322 micrometer, and because of its small size, thought to be a virus also. Other genetic materials are DNA and RNA found in the intestinal tract of ticks, fleas, and mites. So they are gram-negative. So this particular pink color indicates the gram-negative, nature of the bacteria. Typical bacteria with the flagella or pili, etc. And this fever, this rickettsial fever is not a rare condition actually, as I have already. Rather, it is mostly remain undiagnosed or neglected. For example, a routine hospital-based survey because of widespread fever once in Shimaga, Karnataka, using a particular type of test, that is whale Felis test specifically for this particular bacteria, found that out of 277 samples, 31%, that is 87, were positive for rickettsial antibodies. So spotted fever were there, scrub typhus are the most common type of rickettsiosis, and typhus fever are also present. So the message is, it may not be in Shimaga only. In Shimaga, Karnataka, spotted fever, scrub typhus, and typhus fevers are present, and more studies need to be conducted. That is the message. The vectors are mites, fleas, ticks, etc. And epidemiology indicates that these are remarkably under-recognized, absence of clinical, distinctiveness, because the symptoms overlap with other, pathogenic diseases or communicable diseases. That is the reason why clinical distinctiveness is very, very difficult. And availability of effective laboratory diagnostic methods is also very much limited in our states or country, many geographic areas. And another important problem, so far as our public health related to this bacterial disease is, vector-borne bacterial disease is the pet animals and also the wild animals. For example, the reservoir animals are dogs, mice, rats, squirrels, etc. So even if there is no instance of human, rickettsiosis, the pathogen is circulating in the nature among various animals. So the transmission is a usual type of transmission, except in addition to the trans-aerial transmission and trans-radial transmission. Otherwise, vector will take the blood from the infected animal, rats, etc. That is, it is a zoonotic disease. It is a zoonotic disease, and then it will be spread to human beings. Or already the vector will be carrying the pathogen, because the vector would have transferred the pathogen to the egg, from the egg to the nymphs, or larvae to nymphs, etc. Then it can bite the human being. So both horizontal and vertical transmissions are possible. So with regard to the spotted fever, it is acute febrile illness. Febrile illness means high fever. High fever, starting with a high fever. That is why it is called a febrile illness, with rashes on the body. Rash mainly because it will enter the bloodstream, then attack the endothelial cells, and then come out, breaking the endothelium. So naturally, blood oozing will be there. Under the skin, you will find the rashes, blood tinge or blood rashes or spots. So that is the reason why the spotted fever, the name. In most patients, it may be mild or serious complications can result. So usually, these symptoms are confused with either measles, even dengue, or even sepsis or malaria, leptospirosis, etc. Leptospirosis, that is also a bacterial disease spread from the contaminated water, contaminated by the urine or excreta from the infected rats, etc. So like that. So many cases go undiagnosed, as I have already told. And one good news is there is no human to human transmission. So that is one important aspect. So that means a human being the dead end host, from human to human, because of cough or contacts, etc. It will not be transmitted. So Rickettsia rickettsii live within the endothelial cells and cause blood to leak through tiny holes, the blood vessel, into the tissue. This leakage causes the body rashes that is seen in a few days. So that is how from the blood vessel to the endothelial cells and then leak out. So this kind of a situation will create such kind of rashes on the skin and creating, a lot of panic among the suffering persons. So it has got such outer membrane proteins, so many outer membrane proteins which are acting as receptor proteins, and these outer membrane proteins actually, that is surface proteins, OMP-B, OMP-A, etc., or B peptide, etc. These are called outer membrane proteins, are targeted as diagnostic tools. Because these proteins have been identified and they are targeted for the diagnosis of this particular pathogen. Otherwise, in normal course, phagocytosis will be there, then lysosome will be there, and after endocytosis, finally, it will be destroyed, and exocytosis, the waste will be sent out. That is, the destroyed waste will be sent out. That would not happen because it has got the defense mechanism, or it would, come over our defense mechanism. It will go against our defense mechanism. So these are the surface proteins or outer membrane proteins which are acting. That is exchange protein directly activated by cyclic AMP, fibroblast growth factor, well-known endogenous nuclear protein. These are all surface proteins acting as receptor proteins, and the integrins are the principal receptor used by animal to bind the extracellular matrix, etc. So this kind of a transmission from animal to human being, man being the dead-end host, and then from the vector to vector, that is from the adult to the nymphs or larvae, etc. So that kind of transmission is also going. Severe headache, photophobia, that is people would have a fear against the light, then vomiting, diarrhea, that is muscular pain, maculopapular eruption on the palms and soles, that is this kind of eruption because of the breakage of the microcapillaries that will result in spots, and these are called also petechial rash, and that may be on the surface or the appearance of the spot will be having the same, on the same, level of the skin, or it may be slightly elevated. It may be slightly elevated from the skin. So these rashes are called maculopapular eruptions. So these kind of eruptions are common in this spotted, but there are cases, a spotless situation also, or a rashless situation also. So spotted fever need not be always with spots or rashes. So this, fibroblast macula, that is the primary defense mechanism. Other primary defense cells are, affected. Macrophages, dermal dendritic cells, lymphatic endothelium, etc., etc. These are the cells involved in the defense mechanism. So once they pass the primary defense mechanism, naturally they will be circulated and reach the lungs, brain, etc., and resulting in the death. And in fact, rickettsii has been found to be the only organism in the genus that invades beyond the blood vessel lining endothelium. They invade adjacent vascular smooth muscles also, particularly in the arterioles. So it is highly dangerous bacterium, spread by the tick vector or by the exposure to ticks, blood or feces also. It always need not be because of the blood feeding. Even part of the or killed tick or crushed the tick or its blood or feces when enter into the wounds on the human body can spread the disease. The ticks usually will be attached to 10 to 20 hours unless you remove them physically, so that the disease would be transmitted. So a long time they would get attached, or when the skin is exposed to infected tick's blood or crushed tissue or feces from the infected tick. So it would enter the central nervous system and affect the astrocytes, etc. Astrocytes are the cells which would be involved in the integration of the nerve impulse. So once this central nervous system is affected, naturally it will be because of the breaching of the blood barrier, brain blood barrier, naturally it leads to inflammation, leading to fatal situation, neurological damage and fatal situation. So early recognition is very, very important. Of course, anti-rickettsial antibiotics are available, but diagnosis is important. Early recognition is important. Otherwise, inflammation of the tissue surrounding the brain, that is meningitis, will result, or inflammation of the brain itself, that is encephalitis, may be resulted, or unilateral facial nerve palsy will be, recently you would have seen facial palsy, or cerebral infarction, that is ischemic situation, which will result in a kind of hemorrhage, cerebral infarction, that is improper supply of blood to the brain. It is called ischemic situation, visual loss, stroke, then lateral rectus palsy, that is the eye muscles will be affected, so that the coordination of the eye movement will be affected, coma and death. So very serious situation. And appearance of skin rash is not a compulsory thing, not seen in all. So it could be spotless also. So initial discrete macules or pink rashes will result in widespread petechial or hemorrhagic rashes. Like this petechial, you can see the bleeding under the skin. That is the one. Okay, so the vectors are called hard ticks. There are two types of ticks, soft ticks and hard ticks. So these are hard ticks. With one, point, in contrast to mosquito-related diseases are that here both male and female are vectors. Here both male and female are vectors. And hard ticks, you can see a dorsal, armor here. Shield, a dorsal shield is there. That shield is missing in the soft ticks. And a capitulum, that is the mouth parts are just projected out. Soft ticks also got mouth parts, but it is folded, in. So this capitulum or mouth parts, you can see projected out in case of hard ticks. That is how we'll be able to recognize, hard ticks from soft ticks. So it is no doubt it is re-emerging because antibodies have been recovered and cases have been diagnosed wherever appropriate diagnostic laboratories are there or tools are there. Many states are having cases, low index of suspicion, that is because of the lack of facilities. And of course, non-specific signs, it itself has no specific symptoms, because even rashes can be seen in other kinds of infections also. So non-specific signs and symptoms and absence of widely sensitive specific diagnostic test, especially in the rural areas and all. Failure of timely diagnosis leads to significant morbidity and mortality. So we have to be cautious. A kind of caution should be put to the public or sent to the public whenever such situations are there. So diagnosis involves confirmed using serological analysis or assess, indirect immunofluorescence assay, then staining of the rash, etc. could be undertaken. And drugs of choice is doxycycline is the most common drug that is given to the patient, very effective drug if it is diagnosed properly. And many a times even it is suspected as viral fever, etc. Antibiotics would be given, then patient will become all right. That is how all virus, the fever types, many doctors would identify as viral fever. No problem, but if antibiotics are given, then automatically it will be cleared. Azithromycin also will be given. And the most important is whenever people moving around areas, bushy areas or forest areas or fringe areas where, the ticks are just hiding, or those who have got pets, where ticks would be sticking on them. When we visit grassy or wooded areas, etc., we have to check our body for sticking ticks. Also domestic animals you have to take care of, because recently I have seen one of our houses or one of our relatives having a pet, and it was suffering from vomiting and other sickness, etc. Then shown to the veterinary doctor, he has immediately told that you have to take maximum care, especially among the children, because the pet is suffering from leptospirosis. So this kind of because children especially, they will be playing with the pets, etc. We don't know whether the pet has got any infections like that. So before 20th century, actually, these particular diseases were rarely reported in India. Now, in almost all parts of India, this particular disease, has been reported. For example, in 2023, a study in Karnataka found that 8 out of 41 positive samples were of spotted fever positive. So that means depends on the frequency of test or the magnitude of test. If you test more people, just like COVID, no, we were testing more people, we were getting more positive cases. So that would be the situation. So another, type of this bacterial disease coming under this rickettsiosis is endemic typhus or murrain typhus. But here the vector is not a ticks, it is Xenopsilla huopis. That is the rat flea, transmitted by a rat fleas. Just like plague, plague vector is also Xenopsilla huopis. So like that, here also the vector is Xenopsilla huopis. And both male and females are vectors here too. So symptoms are just overlapping symptoms: fever, headache, tiredness, joint pain, muscle aches. About half of the people develop rash also. So that is the reason why you can now imagine that all these symptoms are overlapping with other infections, nausea, vomiting, etc., etc. So usually from rat to flea, because rat flea, if the area is not very hygienic, rat will be moving around. Fleas also will be dropped from the rat, etc. So such cases are there. Even cat fleas are also found to be vectors here. And then from flea to human, but no human to human transmission here also. Murrain typhus is it is also called endemic typhus by Rickettsia typhi. The species of the bacteria causing this particular typhus is called Rickettsia typhi. It is found in United States, Mexico, Europe, Africa, Southeast Asia, Australia, etc. This kind of eruptions could be seen here also. That is the body, eruptions could be seen here also. The treatment, in line with other bacterial infections, doxycycline can be used for any age. Depending on the age, of course, the dosage will be adjusted. There is no vaccine to prevent flea-borne typhus. Only the risk by avoiding contact with the fleas. Fleas, that is, you have to keep the pets also free from. Very, very important. And you have to take, as I was explaining about the, leptospirosis infection in one of our relatives' house, veterinarian should be consulted, and approved flea control products for cats and dogs can be employed. So this another important category of the this bacterial disease is scrub typhus. Scrub, as the title indicates, those who are moving in scrubby areas, the chances of coming in contact with the rats or other mammals moving around, and also the vector would be high, and the transmission of this particular scrub typhus disease is quite elevated here. It was very popular during the Second World War. 36,000 soldiers were incapacitated because of this particular scrub typhus infections. And the Journal of Parasitology, published in 1948, indicates that this particular virus, scrub typhus bacterium, was very much prevalent and incapacitated thousands of soldiers. So occurs in people exposed to areas with scrub vegetation where rodents live, especially in parts of Asia and Australia. It is not seen in US except among travelers. It is a mite-borne bacterium. Its name is Orientia tsutsugamushi. Tsutsugamushi in Japanese language means that insect transmitted or transferred disease. That is tsutsugamushi. Diseases which are spread from or by insects. So it is a mite-borne bacterium belonging to the family Rickettsiaceae. So we have seen tick-borne, flea-borne, and now mite also. Mites are there everywhere. You know that. It just simply appears like dust in our mat or mattress or carpets, etc. These mites are on our pets or the rats moving around, etc. Intracellular, this parasite, this Orangia. Orangia is intracellular parasite of mites. Oval shaped and measures a very small 0.5 to 0.8 micrometer wide, etc. So this is an electron microscopic picture. Reported from several states in India, starting from Jammu Kashmir to Tamil Nadu, Kerala, Karnataka, etc. In some regions, this type of fever, scrub typhus, accounts for up to 50% of undifferentiated fever presenting to hospitals. So just the fever categorized as a viral fever, etc. People have found that 50% of them may be because of this scrub typhus. So this is the map of the country where cases have been found. Yellow shows about 500 cases, 601 to 1,500. That is orange. This orange color. Then red color about 1,500, 2,500, and the brown color about 2,500 diagnosed. That is cases have been diagnosed. But the map, should be shown cases in Jammu Kashmir also actually. So, as in case of other bacteria, naturally clathrin mediated endocytosis, and then its further proliferation takes in the cell. Clathrin is a protein coat, aids in the budding of such vesicles from donor to membrane, etc. And other proteins are also involved in the endocytosis and further proliferation of this particular bacteria. So, in line with other bacterium, the bacterium will be circulated through the bloodstream, and endothelial cells are also affected. Then it will damage the endothelial cells and would come out and infect other tissues also. So for this, for example, it would affect the primary defense cells like polymorphonuclear cells, then monocytes, then normal killer cells, T cells, etc. would be affected. So naturally affecting the defense mechanism to start with. So source of infection is rat usually, and it has been found that the larva of the mite is the culprit here. From eggs to larva, and the larva is the one which is infective. So larval stage of this trombiculoid mites, those are the infective stage where bite animals or humans. And this Orangia Tsutsugamushi parasites, these mites are transmitted to humans during the act of biting. So it is the larval stage that is dangerous so far as these mites are concerned. And during the act of biting, actually, it is not selenophagous type of feeding. This saliva will be utilized for dissolving the tissue, wherever the saliva is injected, and the dissolved tissue will be just taken in by the vector. Helps to dissolve the tissue to facilitate the feeding partially. And this liquefied tissue of the skin and lymph will be taken in, not the blood. So this is called, there is a triangle, what is called Tsutsugamushi triangle. That is from, Japan to Russia, then to the northern Australia, to the Asian countries, up to India, Pakistan, and Afghanistan. So this kind of an infectious circle or triangle is called Tsutsugamushi triangle. And globally, 1 billion people are at risk and 1 million cases are being reported every year. And India too has been declared as endemic, and mainly because of the forest clearing, river banks, occupations, grassy regions, destruction, etc. So mite islands are created. And because of that, the people's movement and destruction of the forest area, entering the mites islands or areas where mites are prevalent, or the mites bearing mammals are moving around, etc. That is how naturally we will be in coming contact with the mice and even pet animals also. And various, experiments or reports from different medical colleges, etc. I am not going to just elaborate it from SMS Medical College, Jaipur, then other, places also it has been related. Extreme cases, fever, headache, etc. And then hypotension, ultimately resulting, if it is not treated properly or early treatment or the treatment fails, then there will be enlargement or edema of the lymph adenopathy, then rashes. XR means further, enlargement of rashes. Interstitial pneumonia, meningoencephalitis, meningitis and encephalitis. Then acute respiratory distress syndrome, ARDS, just like our COVID-19 syndromes, acute respiratory distress syndromes, MODS, multiple organ distress syndrome, MODS, etc. So highly, dangerous situation if the symptoms are left untreated. Symptomatic treatment, antibiotics should be given, whether properly diagnosed or not. Proper dosage of antibiotics might clear these bacterial pathogens. Excuse me. So XR, you find a necrotic XR at the inoculating site. That is where this particular bite is carried out. There will be a marking. There will be a kind of destruction of tissue, a marking, just like a cigarette, burning cigarette butts, piercing the skin, is seen in variable proportion of Indian typhus types. And in that area, that is the area where actually the vector has bitten, a black necrotic area, that is tissue destruction, resembles the skin burn of a cigarette. And also lymphadenopathy, that is enlargement of the lymph glands, and can be seen. Then hepatosplenomegaly, that is enlargement of the liver. Spleen, splenomegaly are seen in majority of scrub typhus. So this type of symptom or appearance at the area of biting, where necrotic tissue, that is destruction of the tissue, is called SR. And it need not be, or the open area. It can be different, parts of the, body. So this kind of area, wherever the, might actually has bitten. So that is, why it is called SR, because of the necrosis of the skin areas. So XR and rashes could be seen, and a very specific, point of infection could be seen by this particular, appearance of XR. And X-ray also, just like COVID-19 infection, X-ray will be very clear with regard to the infection that is damage to the lungs, and a dramatic recovery can be seen after the administration of doxycycline or other antibiotics. Otherwise, there can be inflammation of the heart muscles, myocarditis, then hepatomegaly, that is inflammation or damage to the liver, then cerebral damage or spinal fluid will be infected. There could be meningitis or encephalitis, damage or infection to the lungs that is resulting in pneumonia, etc. So very serious situations can result. So the typical triad is fever, headache, rash. So these aspects should be taken to consideration. It could be other diseases also, but then we cannot neglect, especially when there are rashes. Fever, headache, if it is mild, it may be self-limiting. It may go off with the mild medication or without medication also. Diagnostic tests are available now. It is called Weil-Felix test. Weil-Felix test, very, it is not very sensitive, but still it is being used, non-specific, but then still it is being used. Then there are immunochromatographic tests are also there. LSI is also available. So tests are available, especially immunofluorescence tests are very confirmative by using the, labeled antibody or fluorescence producing antibody, fluorescence labeled antibody with the original antibody. Naturally, this antigen antibody reaction can be detected. So management is by medicine to start with. Azithromycin also can be used in addition to tetracycline. The take-home message is scrub typhus, is re-emerging in India too, and undifferentiated fever, that is in India, wherever there are undifferentiated fever condition, that is febrile fever, it could be suspected, for this particular scrub disease, fever, typhus. Considered differential diagnosis of sepsis and multi-organ distress syndrome. So this could be properly considered differential, testing of sepsis, that is whether the disease is erratically responding to the treatment. So that is differential diagnosis of sepsis. And then the organ, how exactly the organs are responding to the test, treatment. Then search for an XR in the hidden areas of the body. Sometimes people may hesitate to reveal the presence of such rashes or XR in the hidden areas of the body. No, that should not be the case. It should be revealed to the doctor so that he may suggest some of the test or diagnosis done by IgM, scrub typhus, ELISA test is there. Doxycycline is the choice. Caution is, now there is a caution which is being spread of scrub typhus in Odisha. A total of 497 cases of scrub typhus were reported from various districts of Odisha in 2021. Hope that it will not create much panic. But anyway, always a vigil, always precaution, always surveillance against various endemic communicable diseases are necessary. So whether they will re-emerge or it may say new pathogenic disease, etc., we will come to know. And what is the depth of this particular spreading or infection, etc., should be taken. And if it is controlled at the beginning itself, naturally it would be a good relief for the people and also for our public health department. So another important disease of local situation is Crimean Congo hemorrhagic fever. Crimean Congo, these are place names, Crimea, Congo. So the fever which were discovered in these two places combined together Crimean Congo hemorrhagic fever. It's a widespread disease, tick-borne again. Severe hemorrhagic fever here. Hemorrhage, see, whenever, just like the dengue fever, whenever hemorrhage is culminating, naturally it is serious. It is serious. Even if one case culminates or ends in hemorrhage, that should be considered as serious. We need not wait for thousands of cases. And here the case fatality is up to 40%. Primarily transmitted to people by ticks, and even it is present in livestock animals. Human-to-human transmission is also there. I was telling about absence of human-to-human transmission in case of typhus and all. But here, human-to-human transmission is there during blood transfusion and contact, the medical persons having contact with the patients, etc. The transmission of this particular disease to the medical and paramedical people is there. The people who are close with the patient, etc. They have to be very careful. Close contact with the blood or secretions, organs, or other bodily fluids of infected persons are the main source. And it is there in Africa, Middle East, and Asia also. No vaccine or treatment available for this, but only symptomatic treatment. Most frequently among agricultural workers, it was found that most frequently it was found in agricultural workers who actually were making contact with the ticks, etc., or areas where ticks were proliferating. The bite of an infected tick was very much frequent, especially among agricultural workers. Crimean hemorrhagic fever first isolated in Crimea 1945, then same type of pathogen was isolated in Congo in 1950. So together it was called Crimean Congo fever. So mainly in Africa, then Balkans, Middle East, Asia, etc. Fatality rate is very high, about 40%, 45%. Hospital-acquired infection is also very high. Sore throat, abdominal pain, enlarged lymph node, fast heart rate, rash caused by bleeding. So here also mainly symptoms would overlap with other infections. And people at high risk are farmers, animal workers, livestock workers, slaughterhouse workers that stay, especially in the endemic areas. And treatment includes general supportive care with that is symptomatic treatment. And in India, the first fever, this particular fever case was detected in Gujarat 2011, and it was very unfortunate that it was a new disease or unknown disease. So naturally, the medical and paramedical people were treating without protection. So naturally, along with the doctor and nurse, 4 people died or have died because of this particular then unknown disease. So that later, of course, people learned that one has to take utmost care. Severe multi-system syndrome, damage to overall vascular system, symptoms often accompanied by hemorrhage, and sometimes life-threatening also. Includes conjunctivitis, that is eye infections, petechia. Petechia is the rashes, widespread rashes of the skin. Ecmosis is also damage to the organs. And the virus, of course, a typical virus with RNA as the genetic material. And the exuded, that is hard. You can see the capitulum and also the shield here, capitulum, that is the mouth parts exposed. So it is a hard disc. Exuded ticks are especially, the genus Hyaloma are found to be the culprit. Now here, this so far as the transmission cycle is concerned, here in addition to the horizontal and vertical transmission, etc., you find that the human-to-human transmission is also added. That is human-to-human transmission, hospital from hospital, or those who are working in the hospital or those who are maintaining close contact with the patient, relatives or etc., they are likely to get the infection if proper preventive measures are not, protective measures are not taken. So the pathophysiology of this Crimean-Congo viral disease is target organ is the vascular bed. So naturally it is dangerous. Clinical due to microvascular damage is there. So naturally there will be hemorrhage under the skin. Then vascular permeability causing the hemorrhage. In most cases of viral hemorrhagic fever, the coagulopathy is multifactorial, including hepatic damage, disseminated intravascular coagulation, primary bone marrow injury to megakaryocytes. So naturally, all dangerous situation, bone marrow injury, intravascular coagulation, disseminated intravascular coagulation. So naturally, hemorrhage will be there, and then damage to the liver, etc. So, and conjunctivitis is there. Then the hemorrhage under the skin, that is various rashes can be seen, manifestations could be, all these manifestations could be because of the hemorrhage also. Even this, blood tinge the eyes is because of the hemorrhage of the eyes, or the vascular, the tissues of the eyes, or vasculature of the eyes. Human contact can spread the disease. I have already told the disease starts with the short incubation period. Incubation period is 3 to 7 days. And this fever would start to 3 to 6 days following clinical signs. Many times it will be self-limiting. It may go on its own with the symptomatic treatment. If not, further admissions and proper care should be taken. And we have to take all measures to see that it would not affect other organs. Can lead to major organ failure, and serological tests are easier to use. ELISA test is there. So naturally, any suspected, in the endemic areas especially, any suspected fever case could be subjected to this kind of serological test. And to confirm, RT-PCR test could also be carried out just like a COVID-19 test, which is very sensitive. Prevention is the most important thing. Tick bites, should be avoided, as shown in the previous slide, one of the previous slides, as far as possible. Whenever we have moved out of the house to areas where ticks population is prevalent, such areas should be avoided, or after coming back from such areas, we should test for the presence of any ticks sticking to our clothes, etc. Then take care of the pet organisms, and environmental modifications could be done to prevent the prevalence of the ticks, to avoid the habitat of the ticks, examination of skin and clothing for ticks, clothing to prevent tick attachment, etc. Acaricides are the chemicals which are used to kill the ticks and mites. So those chemicals are called acaricides. They are belonging to the Acaricidae family, this particular ticks and mice. So that is the reason why these are called acaricides. Ribavirin is being experimented as a medicine for this. Needs to be measured animals and humans in endemic areas, and it has been found to be, this ribavirin has been found to be useful in animal models. So hope that this ribavirin would work against this particular virus in future. So let me stop it here because my time is over. There are a few more diseases also. Of course, you will be able to refer it whenever you have time. For example, Lyme disease is there. That is also a kind of spirochete bacterial disease. that is also prevalent in India. And this kind of bullseye-like erythema migrans symptom will be produced by this particular Lyme bacteria. So that kind of situation is also there. Lyme disease not, but every rash you find like this bullseye shape may not be Lyme disease also. So that is also there, and the symptoms always overlap with other diseases or other pathogenic diseases. So that also we have to think of some areas Lyme diseases are prevalent, but it is not widespread as other cases. But recently in Kerala, in Ernakulam district, reported a case in a private hospital. That is news 13 March 2024. Case Kuopadi Ernakulam, that also has been. So this disease is a great imitator. That means the symptoms imitate other pathogenic diseases. So that is the reason why we may not be able to identify. And for example, in Bangalore, Karnataka, one person died and found to be, this cardiac complication was in line with the symptom found in USA. And he was found to be positive for this Lyme disease. So, and northeastern India also revealed about 1% seroprevalent, that is antibodies against this particular. Being a bacterial infection, antibiotics could be used, if you find such erythema gravans, that is such bullseye-shaped rashes on the skin. So thank you very much for your patient hearing.